distilled that down to that simple argument that, you can't have gun violence without guns. And that's really a hard thing to argue with.
Hey there, I'm Jesse Mayshark, and this is Headlights, Voices from the Progressive South. Headlights is a production of the Progressive South, a nonprofit media platform dedicated to amplifying progressive voices and values across the southern United States. Voices like Tennessee State Senator Heidi Campbell. That was her you heard up top, talking about a new study of gun violence she and her colleagues released this week. It draws connections between the state's almost total lack of gun regulation and its increasing rates of firearms deaths. That conversation is coming up, and in our arts and culture segment, we'll pay tribute to the late great R&B artist D'Angelo and his musical roots in his hometown of Richmond, Virginia. But first, it's time for the news roundup. This week, we're talking about a key health indicator, the infant mortality rate, and why it is a particular problem in the South. We're now in the third week of the federal government shutdown that began on October 1st. The major demands that Senate Democrats have made in order to support a budget resolution revolve around health care, particularly extending subsidies that help lower-income households pay for health insurance through the Affordable Care Act marketplace, and restoring cuts to Medicaid made in the so-called Big Beautiful Bill that passed earlier this year. Trump and Senate Republicans have shown no sign of budging on those issues, so Democrats and healthcare advocacy groups have started calculating the impact on Americans' access to insurance in 2026 if the funding isn't restored. An analysis by the Urban Institute estimates that losing the Affordable Care Act subsidies would lead to about 4.8 million people losing access to health insurance next year. That population would not be evenly distributed across the states, and southern states as a group would suffer the most. Overall, it would represent a 21% growth in the uninsured population nationwide. But most southern states would see a bigger jump. Mississippi's uninsured population would grow by an estimated 65%, South Carolina's by 50%, Tennessee's by 41%, and Texas and Georgia's by 39% each. Of the southern states, only Kentucky, North Carolina, and Virginia are projected to see uninsured growth below the national average at less than 10% each. And it's not a coincidence that those are also 3 of the 5 southern states that have expanded their Medicaid programs under the ACA, since some of the people losing the ACA subsidies will qualify for the expanded Medicaid coverage. So how does all of that interact with infant mortality? Well, in general, higher infant mortality is correlated with socioeconomic status and access to health care. Southern states already struggle on both of those measures, with higher poverty rates and larger uninsured populations than most of the country, which is why we also have some of the highest infant mortality rates. According to the Centers for Disease Control and Prevention, 6 of the top 10 and 9 of the top 14 states in infant mortality are in the South. Those 9, from worst to still bad, are Mississippi, Arkansas, Alabama, Louisiana, Georgia, North Carolina, South Carolina, Kentucky, and Tennessee. All of the southern states are above the national average for infant deaths. Mississippi, in fact, saw its already worst in the nation infant mortality rate rise last year to 9.7 deaths per 1,000 live births, the state's highest rate in a decade. It led the Mississippi State Department of Health to declare a public health emergency in August. The declaration promised resources to create a statewide OB/GYN system of care and to work to eliminate obstetrics deserts in the state by increasing prenatal care access through county health departments. It did not, however, suggest expanding the state's Medicaid program through the Affordable Care Act, which its legislature has repeatedly voted against. Mississippi is one of the 10 remaining states without expanded Medicaid, 7 of them in the South. That's why some Southern leaders are particularly concerned about the impact of losing the Affordable Care Act subsidies. Remember, Mississippi is expected to see the largest increase in uninsured residents next year if the subsidies aren't extended. Georgia Senator Raphael Warnock, a Democrat, told the news site Notice that, quote, "These are states that historically have struggled both with infant mortality and maternal mortality. Medicaid is part of a safety net that impacts overall health. When that safety net is broken, things like infant mortality are impacted as well as chronic disease," unquote. It almost goes without saying that many of the states with the highest infant mortality rates also now have criminalized abortion, out of what conservative leaders say is an urgent desire to save babies. And yet actual children born in our southern states die at higher rates than in most of the country. Speaking of mortality rates, now we're to this week's interview about gun deaths in Tennessee. Heidi Campbell is a Democratic Tennessee state senator representing District 20, which covers the inner suburbs of Nashville. Like many people in Nashville, she works in the music industry. She has owned her own music publishing company since 1995. Her political career began with serving 2 terms as mayor of Oak Hill, a small town just south of Nashville. In 2020, she ran for the state Senate and won, defeating a Republican incumbent. She was reelected easily in 2024. She also ran for Congress in 2022, losing to Republican Andy Ogles in a district that had just been gerrymandered to give it a Republican tilt. She has long been an advocate for better gun safety regulations in Tennessee, and like most Democrats in the legislature, she became even more outspoken on the issue in the wake of the Covenant School shootings in Nashville in 2023, in which 3 children and 3 adults were murdered. She was joined for our interview by Beth Joslin Roth, a researcher for the Tennessee Senate Democratic Caucus. Roth compiled the data for a new report on gun violence in the state released last week through a caucus-driven project called Tennessee Under the Gun. The data in the report shows that Tennessee has among the highest gun death rates in the country from both homicides and suicides, and that both have risen over the past decade as the legislature has rolled back a number of gun safety laws. The state ranks 7th overall for gun deaths, and those are spread across both urban and rural counties. Tennessee's gun fatalities rose by 40% from 2013 to 2023. It also ranks 8th for gun deaths among children aged 0 through 17, and that rate more than doubled over that same decade, rising to a total of 96 juvenile deaths statewide in 2023. Gun deaths are now the leading cause of mortality among children in the state. We talked about all of that and its policy implications for Tennessee and for other gun-friendly states across the South. So, Seth, let's go to the tape. All right. Well, Senator Heidi Campbell and Beth Joslin Roth, thank you so much for joining me. I really appreciate it.
Glad to be here.
The report that you came out with this week, I think, gets at a lot of interesting. I know it's always hard we talk about causation and correlation, and when you're talking about gun violence, there's a lot of factors and variables, and so causation is obviously difficult, but we certainly can look at correlations, and this report is full of them. And so, Beth, I wanted to start out by asking you, since I know you were the lead researcher on this, can you just talk about the scope of this report? What were you looking to do, and what were the data sets that you were drawing from in trying to get at all of this?
Sure. So, actually, what we put out this week was just an update on data that we've been collecting for a number of years. After the Covenant shooting, we created the Tennessee Under the Gun website as sort of a one-stop shop for lawmakers and the media and the public to kind of get a handle on what the scope of gun violence looked like in the state of Tennessee, as well as tracking every shooting that happens in the state that's reported in the media. So we've been doing that since we gavelled out of session back in 2023. So the data that we've been talking about this week is the most up-to-date data, which is from 2023. And that data comes from the CDC. And the CDC gets that data from the different health departments across the country that upload these fatal injury death reports into this database. The database is called WISCARS. It's a public database that anyone can use, and you're able to just go in and run queries and download that information into spreadsheets and create data sets from them. It's not particularly complicated, but what we wanted to do with the website was to take all of this data and condense it down in a way that made it very easy understand, and that's what we've tried to do. There's additional information on the website as well that we have gotten from the Department of Safety, from the TBI. We're just trying to collect any and all data that we think better informs policy discussions on firearm legislation.
So, in looking at this update, I guess what were the top line numbers? What jumped out at you as? Obviously, Tennessee appears to rank fairly high in gun deaths in general, and then in both homicides and suicides. But what stood out to you?
Unfortunately, we have consistently rated high in all of those categories. I would say what really jumped out at me the most this year was the increase in youth firearm suicides that we've seen. Firearm suicides make up the majority of gun suicides in the country. They make up the majority of gun suicides definitely in the state of Tennessee. That's been a fact for a while, but what we're seeing now is an increase in the number of young people that are using guns to take their own lives, and that's suicide is tragic. Obviously, it's tragic under any circumstance, but firearm suicides are unique in both their impulsivity and their lethality. It takes very little preparation to use a firearm to take your own life, and firearm suicides are almost always successful. So if we can do a better job of keeping those lethal means out of the hands of kids, we can potentially, reduce those numbers. We've had opportunities to address that in meaningful ways in the legislature, and every time, we try, those efforts get shut down.
Yeah, so on the policy side, I guess Senator Campbell, obviously you and your Democratic colleagues have been pushing for greater gun safety regulations of various kinds for several years, and certainly especially since the Covenant school shootings, but before that too. What stands out to you about this report? Did anything in it surprise you, or did it just kind of reinforce thoughts that you already had about these issues?
Yeah, no, it doesn't surprise me. We've been headed in this direction for a long time, and moreover, we continue to make decisions in this state that catalyze more gun violence, and certainly with everything politically revved up the way it is, and the federal government sending troops into our cities and things like that, there's just going to be more volatility. And here's the deal. Beth pointed out to me this morning, because I was talking to her about, what's going on in Memphis. She said, a lot of the incidents in which shootings happen are very personal, and a lot of times it's just some kind of a domestic situation, and there's nothing that the legislature is doing or the National Guard is going to do or anybody is going to do to change that. The point isn't really, what causes these things so much as what you have in your hand when it's happening. And that's the problem. And so, people will continue to have mental health problems. People will continue to fight about things and have, volatility and issues. That's just human nature. But what we should realize is that when people have guns in their hands, when this is happening, that's when people get shot. And I've distilled that down to that simple argument that, you can't have gun violence without guns. And that's really a hard thing to argue with.
Well, and I think one thing that's interesting in here is you use the gun law rankings that are put out by the Giffords Law Center that basically rates states on how regulated firearms are in various ways. And I know they look at a lot of different kinds of laws there. But it is pretty striking. If you look at the list, the rankings of gun violence by state, gun deaths both in homicides and in suicides, the states that have the highest rates of both of those, almost all of them, including Tennessee, rank as an F on those Giffords Law Center ratings. So I guess question to either of you, but what do you take away from that? Because, one of the arguments, certainly by gun rights advocates, is, you can't legislate this stuff, and most people who have guns, don't act violently, and so, whatever you do at the state level doesn't really matter. But I guess looking at those numbers, what does that make you think?
I mean, even if you did say that most people that have guns don't act violently, it doesn't really matter, because if you have some people who have guns who act violently, then you have gun violence. So, and as Beth has pointed out many times, I think, a lot of people are getting these guns illegally. We have people getting guns out of trunks, and, we're not talking about taking people's guns away. That's not something we advocate for. What we want are common sense gun regulations that, keep people safe. And most gun owners, I would say, actually would like safety laws in place, and certainly law enforcement would.
Beth, did you have anything you wanted to add there?
I did, and in response to your question about the rankings, I mean, we presented that data in that way so people can draw their own conclusions, which are pretty easily drawn, which is what you see in every single category and in each age group, is that in states where there are looser gun laws and more people with access to guns, there is more gun death. And to the senator's point, where there are more guns, there's going to be more gun violence. But, what you see, again, in those tables is, there are, of course, some states that have strong gun laws that, have some issues with gun violence, of course, and the opposite is also true. But overall, what you see is that those states with the looser gun laws are experiencing a lot more gun death. And so, again, as you said before, you can't necessarily draw a specific line, but it's pretty hard not to infer that there is some relationship between the strength of the gun laws and really just the attitudes in those states about firearms. Like Senator Campbell said, nobody is seriously having, any real conversations about, taking anybody's guns away on some large scale or banning guns or anything like that. Just doing more to make sure that we're keeping guns out of the hands of dangerous people and people that shouldn't have access to them. And when you see states that do take those measures, what you see is that they have fewer people that are being injured and killed by guns.
Yeah, and I want to get to what some of those policy ideas might be, but there's one other data point I wanted to talk about, which is the difference, or maybe actually the lack of difference, between urban and rural areas. Because another thing that you sometimes hear, like you'll hear people say, well, Tennessee has high gun violence rate, and the response will be, well, yeah, but that's all in the big cities. It's all in Memphis and Nashville, or here in Knoxville where I am. But that's obviously not true. I mean, Memphis, Shelby County does rank as having the highest rate in the state, but then all of the other top 20 counties, I think, were mostly rural. So I guess just what does that indicate to you?
Well, it's important to understand just from a research point that what we are doing when we are looking at this type of data is looking at rates of gun violence. So that's going to be per 100,000 people. And in this instance, when we're talking about firearm fatalities as a whole, we're considering all forms of firearm fatality. So everything from homicides to suicides to accidental shootings to legal interventions and so forth. So really what you see is that, yes, there are a disproportionate number of homicides that are generally happening in our metropolitan areas, but there are also a disproportionate number of firearm suicides that are happening in our rural communities. And as I mentioned before, when we have numbers that reflect that the majority of our gun deaths are suicides, that's why you see those high rates in those rural counties. And it's, again, it's an issue that we don't talk enough about as a state. Senator Campbell has been a champion of suicide prevention. Her along with Representative Freeman have carried a lot of legislation focused on suicide prevention. But when it comes to suicide prevention legislation that has anything to do with firearms, we kind of meet a brick wall. And that's frustrating. And now as we look at the potential of these cuts that are going to impact access to health care in rural areas, that's also going to impact access to mental health care in these rural areas where we're already seeing people that are very desperate, that have easy access to guns and are using them to take their own lives.
Yeah, and so Senator Campbell, I mean, obviously you represent an urban area, but I guess, does this give you, I don't know, another way to talk to some of your colleagues who represent more rural areas, that this is not just, that when we think about gun deaths, it's not just an issue of cities and gangs or whatever people like to say?
Yeah, actually my district happens to be kind of suburban, if not a little exurban in some areas, but because I kind of have I flip this seat. It's very purple. Mm-hmm. But I don't really think that I need to figure out ways to talk to my colleagues, because the dynamic, just to be honest, is really more driven by the Tennessee Firearms Association, and not even, I think a lot of people think that they're spending a lot of money buying politicians or something. They're really not. What they're doing is presenting a threat to these politicians that they will get primaried if they don't stay on board with them and their agenda. So, and that has happened. It happened in the legislature with a woman named Deborah Maggart. Mm-hmm. And it's actually become eponymous. Like, people talk about getting maggarted. You don't want to get maggarted. So it's really not so much about a logical argument as about, and so much of politics is this way now. I mean, I think that we're up against corporate money in a lot of areas, and this is certainly one of them, where we're fighting for the health of our constituents, and in this case, our children. And, we're up against corporations who spend a lot of money to try and prevent us from doing that.
And obviously that'll certainly be the case again when the legislature comes back in January. But I guess even knowing that, I assume that, I guess, are you and or other Democrats going to be bringing gun safety bills again this year? And in particular, what are the ones that you would like to see?
Yeah, so first of all, I want to say you couldn't have anybody better on this call than Beth Joslin Roth. She's, I would say, the foremost expert in the state on gun violence, and I'm very lucky to have her in my office because she's very, very knowledgeable. So I usually look to her in this space for guidance on what legislation she thinks we should run. But that having been said, we do feel like there are some parental responsibility types of legislation where, expecting parents to keep their guns locked up and things like that, and holding them accountable. When, we did talk about violent people getting a hold of guns, but what we haven't talked about on this podcast is toddlers getting a hold of guns and children getting a hold of guns. And a lot more of that happens than people realize. Beth can give you an idea of the numbers, but it is... it's a travesty, and I know, because we have gotten a couple of votes here and there from Republicans, that this is a space where sometimes we can get some people to pay attention with responsibility for gun safety coming from the parents. So I'll let Beth kind of talk to that as well.
Yeah, I mean, we've and we will continue. I mean, I can't speak for the senator, but I know that she and her other colleagues, just because we know these bills don't have much of a chance of passing, we don't see that as a deterrent to not bringing them, because it's important to have these conversations, and it's important for Senator Campbell's constituents and really voters across the state who the vast majority want to see stronger gun laws. It's important for them to understand that there are people that are fighting to strengthen those gun laws. So, we will continue to bring legislation that would hold adults responsible if they leave a loaded gun accessible and a child under the age of 13 gains access to that gun and injures or kills themselves or someone else with it. We have looked at legislation that would hold parents responsible if they leave a gun accessible to a child and the child takes it to school. The parent should bear some responsibility in that situation. We would like to see it be made against the law to give, loan, or transfer a gun to a person that you know to be prohibited from possessing a gun. Currently, under Tennessee state law, if I know that you are prohibited from having a gun and I give you a gun, you're breaking the law by accepting the gun, but I am not committing a crime even though I know that you shouldn't have the gun and I give it to you. I mean, these are very basic, common sense things that I think most people would assume are already in statute. These are just things that kind of speak to basic public safety and basic gun responsibility. But these are things that are in fact not against the law in our state. And we're going to continue to draw attention to things like that because of the number of unintentional shootings we have. I think we're already up to around 20 so far in the state involving kids, many of whom are little. I don't know how many guns have been brought to school so far this year, but I'm sure we've already had, a dozen or so. I mean, that's an ongoing issue. These are things that I think most people support. Legislation last year, Senator Campbell had a bill that we worked with suicide prevention organizations on that was a voluntary do not sell bill that would allow someone who knew that they were struggling with some mental health issues to be able to voluntarily put themselves on a list so that to not be sold a gun, so that at a time when they might be going through an acute crisis, they would not be able to buy a gun. I mean, these are very modest proposals. We're going to keep fighting for them because that's what the people of the state want. There's not any one of these bills that necessarily would, put an end to gun violence, but any one of them has the potential to reduce gun violence, and any combination of them has the potential to reduce it exponentially. And if whether that's 2 or 3 lives, whether that's a dozen lives, those are Tennesseans, those are families, and we need to be doing all we can to try and prevent as many gun injuries and deaths as we can.
All right. So to wrap up, I just wanted to, follow up on what you were just talking about, because I was thinking about, we've talked about red flag laws in this state, and there was obviously a bit of a push for that after the Covenant school shootings that didn't go anywhere. And I feel like the red flag laws often get talked about in terms of preventing something like that, somebody going and causing harm to other people. But it seems to me that red flag laws can also very much serve a function in preventing suicide as well, right?
That's exactly correct. And what we've actually seen, what the data shows, is that states that have passed extreme risk protection orders or red flag laws, gun violence restraining orders, whatever variation, the main metric that you see is a downtick in the number of firearm suicides. In fact, that was the initial reason that those types of laws were drafted. I mean, those have been on the books in states like Indiana, of all places, and Connecticut for years. They weren't controversial because they were seen as a way to combat firearm suicide.
All right. Great. Well, I guess that's as good a place as any to wrap it up. So thanks for all the information, the data in the report. We'll certainly link to both the report and the website in our show notes. And
can I say one last thing?
Yes, of course.
I just wanted to say, one last thing. I think it's important that people in Tennessee know that that solutions like just adding more officers in schools and addressing mental health. We do all of these acrobatics in the legislature to ostensibly address this issue, but when we do that, we not only in some cases are kind of creating a police state, like, we're doing this gun safety education for children. While I don't think that's necessarily a bad thing since we are in this environment, I think it's unfortunate that it's been being done in lieu of actually addressing some kind of common sense gun control, because it gives everybody the impression that something meaningful is happening, and I think we'll find very clearly by the numbers and the lack of change or the increased incidence in gun violence that won't be the case. And so I want people in Tennessee to know that there are organizations that are talking about doing things, but they're not really. They're not doing things because we're not going to solve this problem until we acknowledge that it's about the guns.
Right. That so much of what does get done or passed or funded seems to be about finding ways to live with the problem rather than actually addressing it.
Right.
All right. Well, thank you. Thank you both so much for your time.
Thank you.
The great soul-funk artist D'Angelo died last week at 51 from pancreatic cancer. The announcement was a shock to a couple generations of music fans. He had kept his illness private. Michael Eugene Archer, his given name, was born in 1974 in Richmond, Virginia, where he grew up. He was musical from a young age and by high school was playing with a band that traveled to Manhattan to compete at the famous Amateur Night at the Apollo Theater in Harlem. The experience was encouraging enough for the 18-year-old to drop out of school and move to New York. He got a publishing deal and was for a while a member of a hip-hop group called IDU, which stood for Intelligent, Deadly, but Unique. He took the name D'Angelo, a nod to Michelangelo, the artist, not the Ninja Turtle, and released his groundbreaking debut album, Brown Sugar, in 1995. It became one of the foundations of a new R&B movement that came to be called neo-soul, although D'Angelo disavowed the term. Merging 70s soul grooves and falsetto vocals with an intuitive grasp of hip-hop, it was forward-looking rather than retro. You could hear influences ranging from James Brown and Sly Stone to Donny Hathaway and Prince, but he always just sounded like D'Angelo. He had a sort of signature murk, a slight fog overlaying deep, pulsing grooves. He released only 2 more albums, Voodoo in 2000, including the hit slow jam Untitled, How Does It Feel?, and Black Messiah in 2014. Both are classics. And that was it, 3 great albums spread over 20 years. He had well-documented struggles with mental health, drugs, and alcohol, which accounted for the long period between the second and third albums. After a successful tour following Black Messiah, he mostly receded again from the spotlight, although, as always, there were sporadic reports of new material in the works. So it's possible we'll still hear more D'Angelo at some point, posthumously. His loss was widely mourned by contemporaries and artists who had grown up on his music. Lauryn Hill, who enlisted D'Angelo for a duet on her debut album, wrote on Instagram, quote, "You, sir, moved us, stirred us, inspired, and even intimidated others to action with your genius. Thank you for being a beacon of light to a generation and beyond who had no remembrance of the legacy that preceded us." Rapper and producer Tyler, the Creator, wrote that he got Voodoo for his 9th birthday and, quote, "I had no idea that would help shape my musical DNA." As an example, he pointed to the song One Mo Gin, quote, "That dragging sway of tempo that sounds like a porch-sitting rocking chair, that grumpy but loose bass line, the subject of it, that feeling he's describing felt like a mirror," unquote. One thing that shaped D'Angelo's own musical DNA was growing up in Richmond. It was, and is, a lively music city for many kinds of music. One that stuck for D'Angelo was the local gospel group Maggie Ingram and the Ingramettes. Here he is talking about them during a TV interview with Tavis Smiley.
There was a local group from Richmond. They were a quartet group named Maggie Ingram and the Ingramettes. And the Ingramettes were the 3 sisters, the 3 daughters of Maggie Ingram. And they sang way, way up high in the high register. They were awesome.
The Ingramettes are still around, by the way. Matriarch Maggie Ingram, who formed the group with her 5 children, died in 2015. Her daughter Almeda Ingram Miller now leads the group under the banner of the legendary Ingramettes. And if Richmond was significant for D'Angelo, he was also significant for his hometown and home state. In a tribute in the digital magazine Andscape with the headline, "D'Angelo Brought Virginia's Soul to the World," Writer Justin Tinsley recounts what it felt like to grow up in Richmond in his wake. In Virginia, we knew where D'Angelo grew up, he writes. We knew where he went to high school and just how vital Richmond and Chesterfield County were to his life story. And though it may not have had the musical fingerprint so easily identifiable, those of us from Virginia, in particular the Central Virginia area, a.k.a. the 804, we all knew. We knew him, but the mystery in him never allowed us to know him fully. That's where the intoxication came from. So here's a little of that intoxication from a live performance of One Mo Gin in 2012. And that wraps us up for this week. Remember, the Progressive South is a nonprofit media outlet, and you can find information about contributing to our efforts on our website, theprogressivesouth.org. If you do feel moved to make a donation, first of all, thank you. And second, make sure you make a note in the comments accompanying it that it is for the Progressive South. Thanks to Bark for our theme music and to Lord Seth the Libertarian for his production work at Barbarian Productions. And thanks to you for listening. Remember, you can call and say hey from wherever you are. Just leave us a message at 865-214-7764. That's 865-214-PROG. Tell us your first name, where you're calling from, and take up to a minute to let us know what's going on where you are. You can also write me at jmayshark@theprogressivesouth.org. We'll talk to you later.